This is me, Dr. Sneha, fertility consultant at Oasis Fertility, Chandannagar, Pune. So today we are here to discuss yet another topic related to fertility, and that is IUI. So this session we are going to discuss about what is IUI, what does it mean, how successful it is, and what are the things to remember or to keep in mind to make sure that you can optimize your success rate when you are undergoing an IUI treatment. So, whenever a couple is experiencing difficulty in conception after a regular unprotected intercourse of at least 1 year or 6 months, when the age of the couple is on the higher side, that is when we advise them to consult a fertility specialist. And this is when your different treatment options are explored. So, the first step of any fertility treatment is ideally ovulation induction with timed intercourse, where we guide you regarding your fertile window and what is the optimum timing where to keep a sexual intercourse to make the most out of your fertile window. So, one step ahead of this is when we advise you to undergo an IUI. So, what is an IUI? IUI is one of the ART procedures where it is some assistance is given in order for you to conceive. So, this assisted reproductive technique known as IUI is uh, one step ahead of your natural or ovulation induction, and the full form of it is intrauterine insemination. So, what does this procedure entail? What exactly do we do in this procedure? So, this is as much as natural or near natural procedure where we give some assistance in some form of or the other for both the partners, where follicle development is given by ovulation induction, and semen analysis is also the male factor where there are some issues in the semen analysis are also optimized, and a concentrated sample of sperms is instilled inside the uterus around the time of ovulation so as to maximize your chances of conception. So, what happens is, what do you need to know before we are embarking on your journey with an IUI, and what are the things that you should always keep in mind when you are undergoing an IUI? So, there are a few things that we will try and cover up in this session so that you can make a better informed decision and we can somehow optimize your success rate when it comes to an IUI. So, what do you need to know? First and foremost, there are three factors which contribute to your success rate. These are the major factors. First factor being the egg reserve. So, the egg reserve of the female should be normal or near normal when it comes to her age. So, when the oocyte factor or the ovarian reserve is near normal, we can definitely go for an IUI. When we have already studied the follicular growth, the stimulation, the ovulation has been documented by some previous methods. Another factor is major factor number two, that is the male factor. So IUI is advised when the male factor or the semen parameters are normal or near normal. So uh, the either there are three parameters in the semen analysis that we consider. The first one being the sperm count, the second one being the progressive motility, which is very important when it comes to an IUI, and the third being the morphology of the sperms. The normal morphological sperm should be at least around 3 to 4% for a couple to undergo an IUI. So we optimize these factors, and the processing of the sperm sample is done in such a way that a concentrated form of the best and healthy sperms is only used for conception. The third and most important factor is the tubes. So, when the tubes are open, they are healthy and there are no blockages which has been checked before, then the couple should go ahead for an IUI. So, Sometimes what we do is 1 or 2 cycles of an IUI when the couple is younger or when the duration of infertility is not much can definitely be done without undergoing a tubal patency test. That is when we assume that the tubes must be healthy because the lady does not have any previous history of any abdominal infections, of tuberculosis, any abdominal surgeries. So when these history is not there, then we assume that the tubes must be patent. And when the egg reserve is good, when the sperm factor is good, and the tubes are assumed to be open, that is when we advise 1 or 2 cycles of IUI to be done without a documented tubal patency test. However, if there are 1 or 2 cycles of IUI failure or multiple ovulation induction and follicle monitoring have been done, or in some females when there is history of an abdominal surgery done previously or there is some tubercular infection in the past for which she has been treated, so whenever such a history is there or during a sonography or during a laparoscopy some amount of hydrosalpinx or tubal disease is suspected, then those are the cases where we definitely want to go ahead only once the tubal patency has been documented. So, how do you choose where you should get your IUI done? So, this is the couple who has been suggested to undergo an IUI where the female factor is all right, the age of the female is fine, the ovarian reserve is good, the male factor is also proven, documented to be normal or near normal, and the tubes are also open. So, when these things overall have been evaluated, then you come to a decision as to where your IUI should be done. So always choose a center where you know the equipment required for a good semen wash or semen procedure is available. So a fertility center where there is full-time andrology team available with good equipments and the processing required for semen wash is also optimized and according to their SOPs. So these protocols need to be followed in order to land up with a good sperm preparation technique. So, how do you proceed for an IUI? What are the essential steps to be done when you plan an IUI? So, you visit the fertility center on the second or third day of your periods, and after ruling out there are any cysts in either of the ovaries, the doctor starts you on follicular monitoring by giving you some ovulation induction medications. So, the target would be rather than having a single dominant follicle that naturally occurs in every cycle, we try and form at least 2 or maximum 3 to 4 dominant follicles. And once the follicle monitoring is done and we achieve a follicle size of maybe 18 and above with good peripheral blood supply, that is when a trigger is given for egg rupture and your IUI is planned after 36 hours of your trigger injection. So the timing of your trigger injection and with respect to this trigger injection timing, the timing of your IUI, these two things are also very important. Now, to reinforce another important point, why choosing a fertility center is very important because many a times we hear our patients that they have done an IUI, but it was done in a center which did not have an in-house andrology lab or an in-house andrology team was not there to handle the sperm. So, if suppose a semen sample has been collected after your documentation of the egg rupture, a sample has been collected in the morning at around 10 or 11 o'clock, but IUI is being done in the afternoon at 2 or 3 p.m. So, that duration, that gap between the sample collection and intrauterine insemination is too long because the sperm won't be surviving in a very labile environment. They require strict temperature control. The wash techniques should be optimum, and the protocols should be followed, wherein the sample collection and the ultimate IUI is being done within the span of 1.5 to 2 hours maximum, because the more amount of time that is between the sample collection and the ultimate IUI, the more the chances of your success are going to fall. So the maximum importance of this particular thing is definitely there, that the andrology team and in-house andrology technician should always be there. So what are the other things that we need to keep in mind? How do you choose your optimum fertility centers to get your IUI done? So there are various protocols that need to be followed in order to achieve a good semen sample that would yield you a better result. So there are, depending on your semen analysis and how major the male factor is, there are various techniques of washing the sperm. So there are simple wash techniques, there are swim up methods, there is single density gradient or double density gradient. So the andrologist who is equipped with the knowledge of handling those semen samples takes a decision depending on that particular semen analysis about which wash procedure to be employed in one particular sample, so that the maximum number of motile and healthy spermatozoa are in the final semen sample. So another factor that there should be how the process of IUI is done. So the process of IUI is done via a very thin cannula, which we call as IUI cannula. It is a very flexible and very thin diameter cannula where we load this sample under aseptic conditions, and the patient, the lady, is given a lithotomy position. She is in a relaxed position, and with the help of this thin cannula, we put the sample inside the uterine cavity. So this should be as atraumatic as possible, where we are not catching hold of the cervix or the mouth of the uterus, and as natural as possible without any resistance, we are able to enter the uterine cavity and the semen sample is deposited inside. So this procedure sometimes might be done with the help of sonography. So USG guided procedures are necessary when it might be difficult to negotiate the cervical canal in order to place the cannula beyond your internal os. So sometimes USG guided procedures might also be required. So this is one of the factors to consider whenever to get an IUI done. Make sure that there is facility available for an ultrasound guided IUI if it is required also. This is another point to be remembered. Then the process should be smoothly done. So there should not be any resistance or any bleeding, cramping. However, some amount of bleeding, cramping might happen when the pregnancy is getting implanted, which is a positive sign of your IUI probably getting successful. So another thing is how much to rest after an IUI is done. So we advise a 10 to 15 minutes of rest post your IUI in the same position. Uh, Prolonged bed rest after the IUI procedure of maybe 1.5 hours is not required. Complete bed rest is also contraindicated, because if you are spending your position in complete bed rest, that minimizes your blood supply towards your pelvic organs, and thus it might hamper your implantation rather than benefiting it. So, a 10 to 15 minutes of rest after your IUI is sufficient. Some amount of semen sample might get expelled once you get up, but that is quite normal, because only 0.5 uh, ml of sample is what is required for a successful fertilization. Whatever is surplus, that is getting expelled out, and after your healthy spermatozoa are already crossed that level, and whatever surplus is there, we do not need to keep it inside the uterus. If it's okay if it gets expelled also. So after your IUI is done, the doctor will guide you regarding some basic instructions to be followed to make sure that your implantation or your IUI succeeds. So what are those instructions? So first instruction would be that some amount of cramps or some spotting might happen after 3 or 4 days of your IUI also. So that might be an indication of your implantation happening and implantation bleeding. So take it in a positive way. Don't panic because of this. And if there are any doubts, always connect with your doctor. Another point is to whether the husband and wife can interact and keep a sexual relation after an IUI. So definitely, if it's possible for the couple to keep intercourse at least 3 to 4 days in addition to the IUI, it's going to help in increasing the success rate. So it is definitely advisable if it's possible. Apart from this, there are very few restrictions, like you need not be on bed rest. If there is a job that you are doing that requires you to travel within the city limits, it's definitely advisable for you to continue that job. Your physical activities, you need not limit yourself in your physical activities. So, whatever household work or if there are any exercises that your body is already accustomed with, can definitely be continued. However, if there are some high intensity workouts that you're doing, such as aerobics or Zumba or weight training is being done, then those exercises you should try and avoid altogether until at least you find out whether you're pregnant or not. Apart from this, only a few restrictions in diet. So, whatever diet is healthy for you, try and focus on your healthy diet. So, Indian freshly cooked home meals, there are no restrictions as such. Try to include more of fresh fruits and vegetables, some dry fruits in your diet, and more of a protein based diet. Try to avoid your outside food or processed canned foods which have a lot of preservatives, and oily, spicy preparations from outside should be avoided because after your IUI, we put you on progesterone support, which is luteal phase support. So, in case a pregnancy is happening, we need to ensure that the implantation is happening in an effective way. So, your doctor usually prescribes you some medications which has progesterone, and this progesterone is going to help in the implantation and support of the pregnancy. So this luteal phase support medications sometimes might lead to constipation. So this constipation is something that you should keep in mind, that it might happen because you are on this medication. Medication is something that we cannot skip. Maybe we can change the preparation from one form of tablet to another, but then some amount of GI upset and GI symptoms are definitely there. Apart from this, try and curb your outside food intake, which might lead to further GI upset. Try to maintain a healthy hydration and good, adequate water intake throughout your day. So, this is something that you need to follow once your IUI is done. So after this, the doctor is going to advise you to do a pregnancy test at home with first sample of urine in the morning after a duration of 15 days. Till this 15 days, make sure that you are following these instructions. Once you do this urine pregnancy test, we come to know whether the pregnancy has implanted or not. Once your pregnancy gets implanted, contact your doctor for the further treatment and further management guidelines. However, in case the pregnancy does not get implanted and your pregnancy test is negative, then you have to stop all the medications and wait for your periods to come. Once you get your periods, you discuss what could be the probable reasons for a negative outcome in an IUI. So, IUI, although it's a very good treatment and it's as natural as possible, however, the procedure related success rate of IUI is still up to 20 to 25 percentage. A cumulative success rate of IUI when you are doing 2 to 3 cycles of IUI in continuation in succession might lead to a success rate of 30 to 35 percentage at the most, but then the procedure itself does not tell you a few things, where you don't know the quality of egg, you don't know whether fertilization has occurred or not, and the implantation has happened or not. So these few things are still unknown in the IUI process, and that's why the success rate is limited to just this much. Now, we should also know if one of the IUI fails, one cycle fails IUI, where everything was at par and the follicle has ruptured properly, the endometrium was good, the semen sample was also fine, and the tubes were also good. In this situation, what are the things to take care of in the subsequent IUI cycles? So, if the plan for you is to do 2 or 3 cycles of IUI and a tubal patency test has not been done in the first cycle of IUI, then it is definitely important to plan a tubal patency test along with an IUI in the subsequent cycles. Sometimes minor blockages in the tubes get opened up during the process of your tubal patency testing, which gives you a higher success rate in the immediate succeeding cycles. So, this is one thing to keep in mind. Along with this, if there are any issues in the endometrial preparation where the follicle has definitely grown but the endometrium is lagging behind, so in this situation, some medications in order to develop the endometrium might be added. Apart from this, there are another ways where we can optimize the success rate of IUI, such as we can give a double trigger where instead of just one injection for the follicle rupture, a few more injections can be added to make sure that the rupture of follicle is more effective. And another thing is a double IUI can also be done. So, what happens is once you have taken the trigger injection, we confirm the rupture of the follicle and do a IUI after your rupture. So this is the post-rupture IUI, which is more important. However, sometimes the follicle might escape this timeline of 36 hours post your trigger, and there might be spurious ruptures of follicle before the expected 36 hours also. So in order to catch the follicle during this act, we might plan a double IUI in the same cycle also, where once you've taken the trigger injection, we do one IUI before the rupture of follicle and one IUI after the rupture of follicle. So this gives you an additional 5% of chances where the sperms are already present in the genital tract of the lady, and the sperms might be able to catch the follicle in action immediately after the follicle rupture has happened. So these are the things that can be kept in mind to optimize the success rate of IUI. However, who are the couples who should not go for an IUI? This is also a very important thing to know because we often see in our clinical practice that there are few couples where they have wasted a lot of time, almost doing 8 or 10 cycles of IUI. Their 1 year is lost, and there are very gross indications that this couple was not an ideal candidate to undergo an IUI. So, what are those conditions in which an IUI is not advisable? So, first condition is where there is age of the lady or age of the husband is higher. So, when the female is 35 plus and when the husband is 40 plus, we do not tend to give them more cycles of IUI. Maybe 1 or 2 cycles of IUI can be tried where nothing previously has been tried before. Another factor is if the ovarian reserve of the lady is less. So, diminished ovarian reserve where the follicle rupture is not happening properly, the endometrium is not in synchronization. So, these are the situations where we should not waste much time doing repeated IUIs. Another factor is when there is severe male factor infertility, such as the semen parameters of counts, motility, and morphology are severely depressed, and their optimization with a semen wash technique is not quite possible. So, these are the situations where there might be better chances with an IVF. Another thing is once we do an tubal patency test, maybe a laparoscopy has been done previously, or an HSG or SSG has been done, where we find out that the tubes are not patent, then this leads to tubal factor of infertility. Here, tubal factor of infertility, if it's encountered, there are hardly any chances of conception either naturally or via IUI. These patients usually respond very well, fantastically to IVF techniques. So, these are the situations where not much cycles of IUI should be tried, and there should be a lower threshold for moving on to better techniques such as IVF, which might be much more helpful, and the success rates will be remarkable when the patient selection is done properly. So, all these factors in conjunction, when we see in a patient, in a couple, then it helps us in arriving at a suitable plan of action for that particular couple. So, this was all about IUI and what you need to know before proceeding for an IUI. So, if there are any questions regarding this particular topic, I declare the session free for question and answers. So there's one question. So are there any risks or side effects associated with IUI that one should be aware of? So IUI is a very natural procedure. So the natural procedure itself is boosted by us with the help of some medication, some injections probably, and we try to mimic whatever natural process is supposed to happen. So there are no side effects as such for related particularly to IUI or the treatment and injections of IUI. Yes, sometimes we do encounter that people who have PCOD, there might be overstimulation or hyperstimulation as we know it, where more than 5 or 6 follicles have responded and there are chances of ovarian hyperstimulation syndrome. In those situations, we need to abort the cycle of IUI and devise a proper subjective plan for that particular lady. Apart from this, there are no side effects known, and IUI is a very safe procedure. So that's it for today. If there are any further queries regarding your fertility treatments or you want to take an opinion of an expert, please feel free to contact on the number given below. This is me, Dr. Sneha, signing off from today's Facebook Live session. Thank you.